COVID-19 pandemic has had a devastating effect on a range of clinical services in the Western Cape, with a backlog of around 23,000 elective surgeries in public hospitals. Cancer patients have also been affected. Now, health authorities say many people have died waiting for operations, while the condition of others has deteriorated so much they can no longer be operated on. But the Western Cape Health Department has plans to catch up with that backlog. Ayesha Ismail reports.
It will take years for the Western Cape's health services to function the way they did before COVID-19.
There's been a significant drop in elective surgeries as a result of COVID and us not being able to obviously operate on people and postponing their surgeries. That roughly translates probably to around 23,000 surgeries in terms of the backlog. And if we look at the overall surgical figures, in other words, if we include the more than 30 and the less than 30-minute surgeries, it's also around 22-23% in terms of a backlog. The overall number of operations we generally perform in the province on an annual basis, using 2019 as the baseline, is 165,000. So we obviously take 22% off that, and that's been the backlog that we're generally talking about.
Karim is particularly concerned about cancer patients who have not been able to undergo surgery. They will now be prioritized.
If we look at the cancers particularly, we know that some of the cancers, because these operations have had to be postponed, some cancers have become inoperable. And in fact, we know that some patients have died. So that's why it's important for us to make sure that we actually prioritize the people who are on the waiting lists, to make sure that in fact we take those patients who are more urgent than others and we operate on them first.
The Western Cape Health Department has a backup plan.
So we've allocated 20 million rand from provincial funds to ensure that we catch up. We will distribute that 20 million rand across all the hospitals in the Western Cape province, so not only in the metropole, but also in some of the rural areas.
They have extra hands to help alleviate the backlog. 2 Da Vinci robots.
These robots were purchased at a cost of about 74 million rand for the 2 Da Vinci robots, one at Tygerberg Hospital, one at Grooske Hospital. And in fact, the robots allow us to increase the surgical throughput because the recovery time is less. We can perform more operations, and we can in fact perform these operations on a wider range of people who require surgical services.
Some hospitals are looking into extended surgery hours, including weekends. Ayesha Ismail, Cape Town.